All right, let's jump right in. In the next few minutes, we're not just going to learn some facts, we're going to completely rewire your thinking. We're moving you from a task doer to a true professional nurse, someone who gets the critical why behind everything they do. Let's get this built.
Here's our game plan. First, we'll nail down the huge difference between being a nurse and just being a technician. Then, we'll build the critical thinking engine that's going to power all your decisions. We'll grab some detective tools, translate the nursing process for your exams, talk about what it takes to become a real expert, and then wrap it all up with a recap to make sure you're ready to go. So, what really separates a professional nurse from someone just checking off boxes? Well, it all boils down to one single powerful thing: understanding the why behind every single action you take. I mean, look at this. It says it all, right? The technician sees a to-do list. Give the med, take the BP. Done. But the nurse sees the whole patient. They're thinking, okay, this pain isn't just a number, it's keeping them from moving. If they don't move, they could get pneumonia. So giving that pain med isn't just about comfort, it's a strategic move to prevent a much bigger problem down the road. That's the difference right there. And this whole process leads to our big concept: clinical judgment. Now, this is key. Clinical judgment isn't the thinking part itself, it's the result. It's the final decision you make to act, or maybe even not to act. Think of it like this: critical thinking is the engine humming under the hood, but clinical judgment is you actually turning the steering wheel and making the move.
Okay, so if clinical judgment is the goal, we've got to have a powerful engine to get us there. So let's pop the hood and see what parts we need to build our critical thinking machine.
And here it is. We're literally constructing the nurse's brain, and right there, at the very core, is the main gear that drives everything else. That's critical thinking. So what's the fuel for this engine? It's your knowledge base. And this is totally non-negotiable. You have to know your stuff. I mean, you can't possibly spot that something is wrong with your patient if you don't have a rock-solid grip on what's supposed to be right in the first place. Next up, experience. And listen, this is why your clinicals are so incredibly valuable. Every single patient, every single scenario, it's like you're adding a file to a mental library. After a while, you'll see a new patient and something will just click. You'll think, this feels a lot like that other patient. That's not magic, that's experience. Now for two pieces that go together: competence and environment. Competence is when you're so good at a skill, like starting an IV, that it's almost muscle memory. That frees up your brain to focus on what really matters: how the patient is responding. At the same time, you have to control your environment. A chaotic, high-pressure room with tons of interruptions, that's the ultimate enemy of good, clear thinking.
And our last couple of building blocks are standards and attitudes. Standards are the hard rules. You're precise, you're ethical. But attitudes, man, these are the soft skills that literally save lives. It's the humility to admit when you don't know something, the discipline to do safety checks every single time, and yep, even the courage to take a calculated risk for your patient.
All right, let's do a quick check-in. Imagine a doctor orders a dose that just feels way too high. You get that nervous feeling in your gut, but you stop, you hold the med, and you make the call to question it. What critical thinking attitude is that? Is it A, curiosity, B, risk-taking, C, perseverance, or D, creativity? And the answer is B, risk-taking. Now, I know that sounds a little scary, right? Risk-taking in nursing? But it's not about being reckless. It's about being willing to risk a little conflict, a little discomfort, to challenge something that doesn't seem right in order to protect your patient. That's not just an attitude, it's your professional duty. Okay, our engine is built. Now it's time to stock our toolkit. Every great nurse is basically a clinical detective, and every detective relies on two key ways of thinking to crack the case. So let's get this straight. Inductive reasoning is bottom up. Think of yourself as a detective arriving at a crime scene. You're just gathering little clues one by one to figure out what happened. Deductive reasoning is the opposite. It's top down. That's when you already have a suspect in mind, and now you're looking for specific evidence to prove your theory. Let's try it out. We're going to be detectives at the bedside using inductive reasoning. We start gathering clues. Clue number 1. You notice your patient's urine is a really dark amber color. Okay. You keep looking. What else? You check their skin. Clue number 2, they have poor skin turgor. It's tenting. That's another piece of the puzzle. And finally, you throw the cuff on to get vitals. And there it is, clue number 3, their blood pressure has dropped. It's down to 90/60. So now we have 3 very specific clues.
So here's where the magic happens. You take your individual clues, the dark urine, the tenting skin, the low blood pressure, you put them all together, and bam, you reach a general conclusion. This patient is severely dehydrated. You started at the bottom with the little clues and worked your way up to the big picture. That's inductive reasoning right there.
So we know how to think, how to be a detective. But now we have to act. This is where we take the nursing process you learn in school and translate it directly into the language you're going to see on the NCLEX.
Seriously, you might want to screenshot this. This table is your secret decoder ring for the NCLEX. It shows you how ADP maps perfectly to the new NGN terms. Your assessment, that's recognizing cues. Diagnosis, analyzing cues. Planning, generating solutions. Implementation is taking action, and evaluation is evaluating outcomes. If you know this translation, you'll never be confused by what an exam question is really asking.
And here it is, one of the most high-yield exam tips you will ever get. Unless your patient is literally coding in front of you, you almost never jump straight to an action before you assess. When a question asks for the priority, your brain should immediately scan for the answer that involves gathering more information. Assess first.
So we've got the engine, the tools, the plan. But what's that one thing that turns a good nurse into a great, expert nurse? It's the secret ingredient, the power of reflection.
And reflection isn't just, staring out a window. It's a structured process, and the reflex model is a fantastic tool for it. You recall what happened, you really examine your own actions, you acknowledge how you felt, and then you pull out the lesson. The whole point is to explore what you could do differently and make a real plan for next time. This is how experience turns into true expertise.
All right, let's bring it all together. We've laid all the bricks, we've built all the parts. Now it's time to step back and look at our completed mental model of the nurse's brain.
And there it is, the whole shebang. You see the critical thinking engine at the heart of it, leading to your actions. But the most powerful part of this whole diagram, it's that looping arrow. That's reflection. It shows how the outcome of every single thing you do feeds right back into your knowledge and experience, making you better and smarter for the next time. It's a non-stop upgrade cycle.
Okay, rapid fire recap. What do you absolutely need to remember? 1, it's always about the why, not just the what. 2, clinical judgment is the result of your thinking. 3, master that ADP-IE to NGN translation. It's your key to exam success. And 4, reflection isn't optional. It's the mechanism that upgrades your entire engine.
So I'll leave you with this. Don't just let this be something you watched. Make it real. Tonight, I want you to think of one clinical moment from your past, good or bad, doesn't matter, and just mentally replay it, walk through it using that reflect model. That's your first official step to consciously building your expert brain.